the mental health and also details so that I can explain about it. But when I get this topic and go through the net, internet, etc., go through the books, initially I am not able to understand what is it. When I go through the video and different types of clip and different types of things, then I am able to understand this one is the topic belongs to the doctor as well as psychiatrist. As I know, I have a little knowledge about this field, even I try my level best to explain, so that if anyone has any types of problem, with the help of activity later on, which I just try to collect and I discussed about it. And before starting this one, I am interested to thank Almighty. I get the opportunity to speak about the mental health, and before this, I am interested to start with a story about the Jesus Christ. Because I am from the Christian Missionary School up to the class 10 and even up to the college BSc Honors. I am from the Dawson College, Christian Missionary School. A.K. Singh sir is also from same college. Thank you, sir. And I read lots about the Jesus Christ and go through the Bible, go through the different religious book, even a Quran, say, Bhagavad Gita, and different types of things. And I find lots of things that one is mentioned. I am interested to just mention about the Jesus Christ. When he delivered a speech among the mass, large number of persons reached there, and even the enemy soldiers tried to chase him and reach. When they reach close to him, they find Jesus Christ is teaching nicely. He said, "Do not hate your enemy, love them. Do not hate anyone, do not create problem to anyone. Keep the positive attitude so that even your enemy is your friend." And this one is the best way to love nature. And when I go through the book of the Nostradamus, that one is famous astrologer of the world. When I read about this, what I find, in 1550, large number of persons, they are not interested to reach up to the mosque, they are not interested to reach up to the church. Instead of this, they try to reach to the Mr. Nostradamus. Why? Because that person is not only good, he tells the truth. And truth is nothing but the Almighty. And also same thing about the Prophet Muhammad and Jesus Christ. All the great person have a great thing, enormous mental power, healing power, as well as by speaking they can keep any person cool. And person reach close to them, they get remedy. And today's topic is about the mental health. And regarding the mental health, sometimes I observe some of my friends or some of the students, they are shouting, they are behaving in a different way. Some of them are crying, some of them are fighting, some of them are doing different types of work, and that one is not stood inside the classroom. Same in a society, human beings behave in a different way. The reason is their mental condition is not up to the mark, their mental health is not up to the mark, and that is why they require certain types of remedy, and these types of person need help. Sometimes they get help from the doctor, sometimes they get help from the psychiatrist, sometimes they get help from the family member. By talking and different types of things, they can be easily controlled. And nothing is permanent. Each and everything that may be changed after certain duration of time. Only thing is time. How much time we give. Many years before, when I am practicing astrology, I find one of the person interested to do this research. the person do twice or thrice and say, I will do it. It is nothing but regarding the mental health. When I talk to him, as well as help little bit, at that time I get little bit amount of money through the private tuition, etc. I just purchase some of the item and donate that person, and talking with him, then what I find, that person gradually become normal and left the thought of doing suicide. Suicide, anxiety, it is nothing but it is related to the health problem and mental health problem. And mental health problem is today reached in such a way human beings are fighting with others. For example, present day situation, Vladimir Putin attacked Ukraine. It is due to the mental problem. And due to the mental problem, the president is taking certain types of drugs, aggressive nature that one develop. And only way, if the person gets suitable types of help by the psychiatrist as well as doctor, it may be possible, it may be reduced. And another thing I find, the planetary position of the human being is not remain same. Yes, sir.
Yeah. You said that Russia attacked Ukraine.
Yes, sir.
So you say it's a mental problem.
Yes, sir.
Yeah, it is elaborate.
Okay, just a minute. I am interested to tell about this one. It is one of the mental case. It is known as a post-traumatic stress disorder. Those persons have in this types of problem, post-traumatic stress disorder. This types of person are very aggressive. They can kill other. They can attack. They can fire. They can do the war. Any types of thing they can do. And this types of thing I find inside Vladimir Putin. He is aggressive. And one side he is interested to save his country against the USA. NATO force reach close to him. They are interested to join Ukraine in their group, and Russia tried to say why Ukraine have lots of nuclear
It
weapons.
means Mr. Putin is undergoing this kind of disorder.
Yes, sir. He have a disorder. He is taking the treatment. He is
He is taking treatment also.
Yes, sir.
You read somewhere?
Yes.
You read or heard?
No, this one I just go through the net. I find this one, and he is taking medicine, etc. And that is why he is in stress.
If I am not wrong, it's an information illiteracy. I think Putin is at the age of, I think he is 75 plus.
Okay? Yes, 70 years.
70 years.
Yes.
And he is mentally fit, physically fit, emotionally fit, the best fittest person in the world if they are the leader. He can be in a swimming pool with a temperature in
0 degrees.
minus, not 0 degree. Okay,
Yes, sir.
he can ride on the horse
Yes.
continuously for 2 hours.
Yes.
Okay, he can fly aircraft for 6 hours.
Yes, sir.
He can be under the submarine for more than 48 hours.
Yes, sir.
So these things are read regarding him.
Yes, sir.
I don't think that he is undergoing any kind of mental health problem.
He is fighting for his
Okay.
country's existence.
Yes, he is fighting for his country to save against the nuclear weapon because Ukraine.
I don't know much about this mental health.
Yes,
This
sir.
You
is a
said
strategy
that-
of
I want to
political
understand
strategy.
that part. You said that he is undergoing mental health.
Yes, sir.
Because definitely he is the president of Russia, so many expert doctors will be there for him. If doctor will feel that someone is having mental health or disorder problem, first of all he will suggest the other ministry to remove them from the post. It is dangerous for the country. Don't you think so? If
Yes,
our
sir.
Prime Minister Modi undergoes this kind of mental health problem, do the bureaucrats will help him to continue?
No.
And definitely bureaucrats will
Help him to recover.
come into action. That sir, you please go for rest for 1 month. Let some other person take charge for few months. So can you first please explain what is mental health? Then I can
Okay.
understand that part.
Okay.
Sorry if I have misguided the session.
Thank you. Regarding the mental health, human being. Okay. Excuse me, sir. First, I am interested to show some of the video clip, and after that, I will explain. Okay.
Mental health. What is it? Mental health is our ability to respond to the challenges that life throws at us. We can have all sorts of mental struggles about money, work, relationships, family, health, or just life in general. Good mental health is our ability to function, to bounce back from these struggles, and to be able to move forward. Being able to deal with the worries of everyday life helps us build resilience, which is another way of saying good mental health. Resilience can help us when our problems seem overwhelming. Without it, our mental health could spiral out of control, changing the way we feel, think, and behave. It could mean being worried or afraid all of the time, feeling numb or like nothing matters, or losing touch with what is real. When this happens, it can take some time to get back on track. At these times, it's important to reach out for help, whether it's through friends, family, or mental health professionals. Finding the right support can help us get back to feeling ourselves. Sometimes, though, professional advice is needed. But where do you find that? Head to Health can be a guide to help you find the right information, support and advice from trusted service providers. Head to Health. We're here to help.
Before we begin, we'd like to add a quick warning discussion. This video discusses mental illness, including eating disorders and PTSD. What is mental illness? According to National Alliance on Mental Illness, it's defined as a condition that affects a person's thinking, feeling, or mood for a sustained period of time that negatively impacts them. You might be wondering, is depression a mental illness? What about anxiety? Yes, they are. In fact, they're the most common types of mental illnesses. In this video, Psycho covers 10 of the most common types of mental illnesses. 1. Anxiety disorders. We know 18.1% doesn't sound like a lot, but that's the number of adults in the US who suffer from anxiety disorders. 40 million people suffer from symptoms of an anxiety disorder every year. Of those 40 million people, it's estimated that only 36.9% of them will get help. Anxiety disorders rarely appear alone, with depression being a common co-diagnosis. Anxiety disorders come in a few varieties. Generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, SAD, and obsessive compulsive disorder, OCD. So, what do all these anxiety disorders have in common? They're all characterized by nearly uncontrollable worry that messes with several aspects of daily life, such as sleep, relationships, school, and work. The good news is there are several treatment options available, which include different types of therapy and medication. 2. Personality disorders. What does it mean when someone's personality is disordered? Personality disorders refer to behavioral, emotional, and thought patterns that deviate greatly from the expectations of an individual's culture. The National Institute of Mental Health suggests that 9.1% of the population has the traits of a personality disorder. So what does this look like in real life? Could anyone who's a little different be diagnosed with a personality disorder? Well, according to the diagnostic criteria in the DSM-V, these differences must be causing the individual significant amounts of distress in the way they see themselves, others, and situations, inappropriate or exaggerated emotional responses, impulse control, and how well the individual relates to and functions around others. Personality disorders can't be cured, but thankfully they can be treated. This treatment consists of combinations of medications for the underlying mental health issues, as well as talk therapy. 3. Attention Deficit Hyperactivity Disorder. If we say ADHD, what comes to mind? The stereotype of a person diagnosed with ADHD is usually a small child who's bouncing off the walls or can't finish a task. However, between 7.8 and 11% aged 4 to 17 are diagnosed with ADHD any given year. ADHD affects people of all ages and includes multiple symptoms, such as inability to concentrate, forgetfulness, inability to sit still, restlessness, and losing things. An individual's symptoms vary depending on their age, gender, and type of ADHD. Did you know there's actually 3 recognized types of ADHD? They're ADHD, combined type ADHD, impulsive hyperactive type, and ADHD inattentive and distractible type. Most people think meds are the only way to control ADHD, but many people diagnosed with the disorder find relief by using a combination of medications, life coaching, education, and talk therapy. 4. Post-traumatic stress disorder. Did you know that an estimated 6.8% of the US population will develop some form of post-traumatic stress disorder? That's about 19 million people in the US alone. So how does this happen? You, me, everybody will get stressed out by something in our lives. Some people will come across something so stressful that it affects them permanently. For many of them, this stress becomes trauma. A traumatic event is considered any event that should not have happened, such as a natural disaster, an assault, childhood neglect, abuse, starvation, and so on. Stress is a completely normal reaction to trauma, but what happens when the threat is gone? The stress and trauma stops on its own for most people when the mind and body understand the individual is no longer under attack. But what if the mind and body don't get the memo? Post-traumatic stress disorder refers to a prolonged fight or flight response that happens after the stressful event has stopped. Complex post-traumatic stress disorder, CPTSD, refers to the PTSD that occurs due to a series of continued traumatic events, such as childhood abuse. Think of PTSD and CPTSD as the echoes of the stress response. These echoes can happen in the form of emotional flashbacks, nightmares, extreme anxiety or panic, difficulties connecting to others, and an overwhelming sense of fear. So how does someone get help for something so overwhelming? People suffering from PTSD or CPTSD can find relief through trauma therapies, such as eye movement desensitization reprocessing, EMDR, or traditional talk therapies, such as cognitive behavioral therapy, CBT, or dialectical behavior therapy, DBT. 5. Depression. An estimated 6.7% of the US population over the age of 18, 15.7 million people live with depression. Although the occasional low mood is a normal response to negative situations, depression entails low moods that are severe and last longer than 6 weeks. Depression manifests differently in women than men. Women tend to experience depression as feelings of sadness, worthlessness, and shame or guilt. Men tend to mistake the symptoms of depression as fatigue and being easily irritated. Common treatments for depression include cognitive behavioral therapy, CBT, interpersonal therapy, IPT, psychodynamic therapy, psychoeducation groups, antidepressants, and various brain stimulation therapies. 6. Bipolar disorder. An estimated 2.8% of the US population that sought mental health treatment was diagnosed with some form of bipolar disorder in 2018. This number may be low, as many individuals who suffer from any mental health disorder do not seek treatment. Bipolar disorder means a lot more than just really bad mood swings for a couple of reasons. First, people diagnosed with bipolar disorder cannot completely control these mood swings. And second, these mood swings range from manic, feeling super happy or invincible, doing crazy spontaneous things, grandiosity, and having racing or unrealistic thoughts, to extreme bouts of depression and maybe a little hypomania in between. Living with bipolar disorder isn't easy, but people struggling with the disorder can find a variety of medications and traditional counseling treatments to help them find more balance. 7. Eating disorders. Did you know there are almost as many people living with eating disorders as there are with bipolar disorder? It's true. Approximately 2.7% of individuals who sought treatment were diagnosed with an eating disorder in 2018. The most common question people ask about eating disorders is what's the difference between not being happy with your body and having an eating disorder? Well, in addition to this total focus on their physical flaws, eating disorders are defined by dysmorphia and the binge, purge, restrict cycle of behavior. This cycle comes from the person's feelings of extreme distress and disgust about their body. This disgust drives the individual who has the disorder to become super focused on their body weight and shape. Leave a comment below if you want to know more about the binge, purge, restrict cycle. The eating disorders everyone knows about are anorexia nervosa and bulimia, but most people have never heard of eating disorders not otherwise specified, EDNOS, or avoidant restrictive food intake disorder, ARFID. Leave a comment below if you want to hear more about the lesser-known eating disorders. Everyone needs food, so how is someone who has such a terrible relationship with eating and body image supposed to get better?